It's Harry here. Welcome to Money Teacher. So, President Trump announced what he's calling the Great Healthcare Plan. And whether you're excited, confused, skeptical, or just tired of the whole system, this matters to you. Healthcare costs touch almost every part of our lives. Premiums, prescriptions, surprise bills, all of it. And here's something that surprised a lot of people. This announcement came right after millions of Americans started seeing higher insurance costs because extra help they relied on quietly expired. So yeah, the timing here isn't random. This plan could shape how you pay for care, how much control you have, and where your healthcare dollars actually go. And understanding this could save you stress, money, or at least give you clarity in a system that rarely offers it. Before we get too far into it, quick question for you. When you think about healthcare right now, do you feel more confused or more frustrated? Let me know in the comments because honestly, most people tell me it's a mix of both. So let's talk about what was actually announced because there's already a lot of noise out there. The first thing to understand is that this isn't a finished law. It's more like a blueprint or a framework. And I know that alone can feel unsatisfying, but it matters. The White House was very clear that this is direction, not a fully written bill. Congress would still have to turn this into actual law with details, rules, and guardrails. That's important to keep in mind as we go through this because some of the biggest questions people have are still unanswered. Now, the reason this announcement landed with so much weight is because of what happened just weeks earlier. Extra subsidies that help people afford insurance under the Affordable Care Act expired at the end of last year. For a lot of families, that meant premiums jumped sometimes by hundreds of dollars a month. And if you're on a fixed income or juggling rent, food, and medical costs, that kind of increase hits hard. So when the administration talks about lowering costs and sending money directly to people, that message is clearly aimed at folks feeling that pressure right now. One of the clearest parts of the plan, and probably the part you've heard the most about, is prescription drugs. This has been a major focus. The idea here is that Americans often pay way more for the same medications than people in other wealthy countries. Same drug, same manufacturer, but wildly different prices. The administration says that's not fair, and they want to tie U.S. prices to the lowest prices paid abroad. This approach is often called most favored nation pricing. In simple terms, if a drug company sells a medication cheaper in another country, Americans should be able to get something close to that price too. The White House says they've already started negotiating voluntary deals with drug makers, and many companies have agreed to some form of price reductions, especially for certain government programs. Now, you might have heard some big numbers thrown around, like prices dropping 80 or 90%. Those claims grab attention, but they need context. In reality, these discounts apply to specific situations, mostly tied to government programs or direct purchase channels. If you're insured through your job or buying coverage on your own, you may not see dramatic changes right away. Still, supporters argue this sets a precedent, and once it's written into law, it could expand. If you've ever stood at the pharmacy counter and thought, wait, why does this cost so much? This part of the plan speaks directly to that frustration. And yeah, I've been there myself, looking at a receipt and wondering how a small bottle of pills turned into a budget problem. Another big piece of his plan is where the money goes. And this is where things get more controversial. Right now, a lot of government healthcare assistance flows through insurance companies. Subsidies help lower premiums, but the money goes to insurers first, not directly to you. President Trump has been very clear that he wants to flip that. His argument is that the money should go straight to people, letting them choose how to spend it on healthcare coverage. On the surface, that sounds empowering. More control, more choice, less middleman involvement. But here's where the details really matter and where critics start raising red flags. If people use that money to buy cheaper plans that don't meet current standards, it could leave sicker or older patients in more expensive insurance pools. That could push premiums even higher for those who need comprehensive coverage the most. And this is one of those moments where you see the tension between flexibility and stability. Choice feels good, but healthcare markets are delicate. A small shift can have big ripple effects. The plan doesn't clearly spell out how protections like coverage for pre-existing conditions would be enforced under this new structure. And that uncertainty is a big reason why some people are nervous. Another thing the plan emphasizes a lot is transparency, and honestly, this is one area where there's broad agreement that something needs to change. If you've ever gotten a medical bill weeks after a visit and thought, "I had no idea this would cost that much," you're not alone. The administration wants hospitals, insurers, and providers to clearly post prices, explain coverage in plain language, and disclose things like denial rates and wait times. The idea is that sunlight changes behavior. If prices are visible, providers compete. If denial rates are public, insurers behave better. That's the theory. And while some studies show mixed results, transparency still resonates with people because the current system feels secretive and one-sided. There's also a strong focus on cutting out middlemen, especially pharmacy benefit managers. These are companies that negotiate drug prices behind the scenes, and critics say they often drive up costs while taking a cut for themselves. The plan calls for ending certain rebate and kickback practices, arguing that savings should go to patients, not intermediaries. What's interesting here is that this criticism isn't just coming from one side. There's growing bipartisan frustration with how complex and opaque the healthcare system has become. So even if people disagree on solutions, there's shared recognition that the system isn't working as cleanly as it should. Now, stepping back for a moment, it's important to understand the political context. Health care has always been one of the hardest issues to tackle in this country. Every major reform has taken years, sometimes decades, to fully implement. What we're seeing here is a broad vision paired with strong language but light on mechanics. Supporters see leadership and direction. Critics see unanswered questions and potential risks. If you're watching this and thinking, "Okay, but what does this actually mean for me right now?" That's a fair question. The honest answer is not much has changed yet. This is an announcement, not a law. Your coverage, your prescriptions, your premiums stay the same for now. But what has changed is the conversation. This plan shifts the debate toward cost control, transparency, and who controls healthcare dollars. It puts pressure on Congress to act, especially with voters already feeling the impact of rising premiums. And it signals where the administration wants to go, even if the road there is still unclear. I've seen a lot of comments from people saying they're just exhausted, tired of hearing promises, tired of fighting bills, tired of systems that feel stacked against them. And that's real. Healthcare isn't just policy. It's personal. It's your stress levels, your sleep, your ability to plan for the future. What I'll say is this: pay attention to the details as they emerge. Big ideas matter, but specifics matter more. How protections are handled, who qualifies for help, how markets respond. Those are the things that will determine whether this actually helps people or creates new problems. And if you haven't shared your thoughts yet, feel free to jump into the conversation below. It really helps keep this a two-way discussion. As more details come out, we'll keep talking about what's real, what's possible, and what it actually means for you and your family.